Okay. Hi, everybody. Welcome back. We're going to get started on our Practicum 2 certification review session number 3. These work. There we go. Okay. So as always, there's going to be a packet to accompany the certification review session. So please locate that in your student resources folder in Blackboard. Make sure that you download and print a copy of certification review session number 3 questions so you can follow along with today's lesson. As always, we're going to be utilizing our test taking strategies, making sure that we are fully prepared to take a multiple choice exam by the end of Practicum 2. So just a recap, you're going to read the question in its entirety, take a chance to slow down, really think it through before you start looking at all of the answers, try to digest the question, pick apart what it's asking you, and try to answer it in your head if you can. Once you've done all that, you can go ahead and read the question one more time. This is so you identify any of those key words that you may have missed the first time you read the question and make sure that you fully understand what the question's asking you. Then you're going to discard at least 2 options to get down to a 50-50 to give yourself a better statistical chance of getting it correct. And then you are going to answer your question with confidence. Do not go back and change your answer. You've already done your due diligence by performing your test taking strategy steps. Go with your gut. Do not change your answer. Okay, for today's learning objectives, we're going to talk about peripheral vascular anatomy and physiology and intraoperative procedures. Then we're going to jump into some questions that have a lot to do with utilizing our medical terminology. Okay, so I'm going to get out of presentation mode here so we can answer this question together as a group. So question number 1, a portal circulation involves passing blood from the major organs in the abdomen to the... Okay, so I'm going to stop. Not going to look at A, B, C, and D. Try to think through. Portal circulation, major organs, sending it through the portal circulation. So I remember talking about portal circulation in the vascular chapter. And I specifically remember a specific organ that's related to the portal vein. So I'm going to think about that in my head. I'm going to double check, read the question one more time to make sure I understand it correctly. Portal circulation involves passing blood from major organs in the abdomen to the... So we're in the abdomen. At least the organs that are supplying the blood to this portal circulation are in the abdomen. So I'm trying to think of all of the organs that are within the peritoneal cavity. Yeah, my answer still stands. I'm going to go through A, B, C, and D and see if my answer's in here. So answer A is kidneys, B is liver, C is mesentery, and D is spleen. Now, my understanding of the portal circulation, the thing that I remember most about the word portal when it comes to vascular is the hepatic portal vein. And in my head, I know hepato means liver. So that was what was in my head. I'm going to keep liver on my board. Other circulation. So why would the major organs in the abdomen pass the blood through this circulation? Well, if it's not going directly back to the heart, the other areas that the blood will circulate through before it goes back to the heart are the organs responsible for filtering the blood. And those 2 major sites are going to be the liver and the kidneys. There's no reason to pass anything through the spleen. So I'm going to get rid of spleen. Well, I mean, there is a reason to go through the spleen. The spleen's one of its major responsibilities is to recycle and destroy old erythrocytes, old red blood cells. I still don't see why that would. Let's go to mesentery. Mesentery has to supply blood to the small intestines. That doesn't make sense to for any of the other abdominal organs to send their blood through the mesentery. If anything, the nutrients from the mesentery would go out. So I'm going to get rid of mesentery here. What else? So the kidneys, they're the renal arteries and veins. The kidneys are still responsible for filtering the blood. The liver is also responsible for filtering the blood. I'm gonna get rid of spleen, even though it does have some responsibility in recycling old red blood cells. I feel like kidneys and liver are the better options as far as why major organs would send their blood to a different organ other than the heart. So, yeah, I'm going to stick with liver here because of remembering the hepatic portal vein. That's going to be my answer. And I am right. So, if you can see here, oh goodness, I've gone too far. You can see here, this is the portal circulation, the portal vein, and all of its branches. All of the blood is going to go through the hepatic portal vein to get filtered to metabolize toxins in the blood, specifically metabolize drugs. So that is our answer, liver. Okay, I'm gonna go back into presenter mode. Now, on your own, you're gonna answer numbers 2 through 15 using your test taking strategies. When I say pause, you're going to hit the pause button, answer numbers 2 through 15 on your own, take as much time as you need. When you are finished, you can go ahead and press play on the video recording, and we'll go through the answers together as a group. Okay, on the count of three, 1, 2, 3, pause. Welcome back. Okay. Number 2, which pathway involves the formation of fatty plaque within the lumen of a blood vessel? That is your atherosclerosis. Athero meaning fatty, plaque, or buildup. So you can see here in my image, the artery is narrowed by the plaque. Sclerosis means hardening, so that plaque can harden and it can cause increase in pressure of blood pressure because the pathway for the blood to flow is smaller. So in order to get the same amount of blood through that narrow pathway, it needs to go faster. So it can cause lots of complications. So atherosclerosis is our answer there. Number 3, the superior vena cava and inferior vena cava supply deoxygenated blood to the right side of the heart and the superior chamber. So it's going to be the right atrium here. Okay. Remember, right side of the heart is deoxygenated blood or oxygen poor blood. I always say the right side is blue, left side is red because the left side of the heart is going to have oxygen rich blood or oxygenated blood. Okay, number 4, abnormally high blood pressure. That's going to be hypertension. Hyper meaning more than normal, and tension referring to the force exerted on the walls of the blood vessels. There we go. Okay, number 5, which arteries supply the intestines with blood? That is your mesenteric artery. The superior and inferior mesenteric arteries are going to give rise to all those branches. Yeah, they arise off of the abdominal aorta. Okay, the aorta begins at the aortic root. The root here, as you can see, if you can see my cursor, is going to be what physically attaches the aorta to the aortic semilunar valve. And so the left ventricle can supply the oxygen-rich blood into the aorta. So that's where it starts, at the aortic root. From the root, it's going to turn into the ascending aorta, into the aortic arch, and then take a turn south into the descending aorta. And as it descends, it's going to go through the thoracic cavity. So that's called the thoracic aorta. And then it will end and bifurcate in the abdomen. So the terminal end of the aorta is called the abdominal aorta. And it will bifurcate into the iliac arteries, the common iliac arteries. Number 7, which of the following refers to vascular obstruction and tissue death? That is infarction. Myocardial infarction is another word for heart attack. So if that helps you at all to remember, but an infarcted region is going to be because of limited blood flow. Number 8, a blood clot that is stationary in a blood vessel is called a thrombus. Difference between a thrombus and an embolus. Thrombus does not move. Okay, an embolus can move through the circulatory system. That's why in the image here you can see the embolus has that little up arrow because the embolus is moving. What happens with an embolus, the word embolo means a wedge or a cork or a stopper. What's going on with an embolism is it is a freely moving foreign body in the circulatory system. It's either a blood clot, it can be air, it can be a tumor, it can be fat, it can be anything that is not blood flowing through the circulatory system. That's what an embolus is. And what happens that can potentially be so dangerous about an embolism is that when it finds a blood vessel it can't fit through anymore, it's going to wedge itself in there almost like a cork in a wine bottle. And that can cause occlusion and obstruction and potentially ischemia and potentially necrosis if the embolism is not resolved. Okay, so that's the difference. A thrombus is a stationary blood clot. It has not dislodged and has not started circulating. Number 9, the force exerted on the vessel walls while the ventricles contract. That is systolic pressure. So systolic, I say systole is squeeze. I kind of use my alliteration there. Diastolic pressure is when the ventricles relax, when the heart is at rest. So systolic is going to be squeeze. Diastolic is at rest. Number 10, the site of gas exchange in the body occurs in the capillaries. That is where the arterioles and venules are going to meet here at the capillary bed. They're also the smallest blood vessel in the body, the capillaries are, and that is going to be the site of tissue perfusion. Okay, number 11, veins differ from arteries because all veins contain valves. Veins contain valves that allow for that one-way blood flow. Number 12, the peripheral veins pump blood via the contraction of skeletal muscles. As you can see here in the image, the skeletal muscles will physically contract. They will squeeze the blood essentially against gravity, open those valves, push the blood up, and when the muscles relax, the valves will close and prevent that blood flow, from going backwards. AAA is a pathology affecting which artery? This is an abdominal aortic aneurysm, AAA. Number 14, which is the only artery in the blood that carries deoxygenated blood or oxygen poor blood? That is going to be your pulmonary artery. That's because it's still carrying blood away from the heart. That's why it's an artery, but it's connected to the right side of the heart. That right side of the heart has oxygen poor blood. The pulmonary artery is sending that oxygen poor blood away from the heart towards the lungs to pick up that oxygen. And then number 15, which is the outermost layer of a blood vessel, the answer here is tunica adventitia. And you can see here in the image, the 3 layers of the blood vessel from outermost to innermost. Outermost is going to be your adventitia, also known as the tunica externa. The middle layer is going to be your tunica media, and that is going to have your smooth muscle. And the innermost layer is going to be the tunica intima. Okay, so we're now going to move on to peripheral vascular intraoperative procedures review. When I say pause, you're going to pause the video and then answer numbers 1 through 15 on your own using our test taking strategies. When you're finished with that, come back, press play. We'll go through the answers together as a group. On the count of 3, ready? 1, 2, 3, pause. Welcome back. All right, number 1, which of the following medications is used to prevent vasospasm? That is going to be papaverin. The others do not prevent vasospasm at all. So hopefully you were able to get down to that 50-50 for papaverin. That one's kind of a tricky one. Number 2, which is the most common arterial access? What is the most arterial? God bless, can't talk. Which is the most common arterial access point for endovascular surgery? That's going to be the common femoral artery or vein, depending on what you're doing, but usually we're going through the groin. That is the most common site. Which of the following is used to prevent pulmonary embolism? I'm going to go back really quick. Arterial access point, common femoral artery. I'm sorry, I need to make sure that I clearly read my questions. So it'd be the common femoral artery. Okay, sorry, going back. Number 3, which of the following is used to prevent pulmonary embolism? That is going to be your inferior vena cava filter. And it almost looks like a little upside down umbrella. It is going to catch any traveling embolism, blood clots usually, that arise from deep vein thrombosis. So a deep vein thrombosis is stationary in the blood vessel, and then when it dislodges, it becomes an embolus, and usually because they're so big, they'll get wedged into the pulmonary artery. That's why it's called a pulmonary embolism. It wedges or kind of stops in the pulmonary artery because the pulmonary artery is too small for that blood clot to fit through. That can be a potentially fatal complication. So that's why IVC filters can be implanted in patients who have chronic DVT issues. Okay, number 4, which vessels are most commonly used to create an arteriovenous fistula? Most common in the arm, and this is going to be the radial artery and the cephalic vein. Number 5, aortofemoral bypass is performed to treat occlusive disease of the iliac arteries. This image is a really helpful one for me. The way I remember bypass, especially when it comes to aortofemoral, I like to think about what is the middleman, if you will. So you can see here, if you can see my cursor, this is the abdominal aorta. It bifurcates into the right and left common iliac arteries. The external iliac artery then turns into the femoral artery. So what we're doing is we're creating a bypass between the aorta and the femoral arteries. So you're looking for what the middleman is. That's what we're bypassing. So that's why it's performed to treat occlusive iliac artery disease. Number 6, a thrombectomy requires the use of which catheter? That is a Fogarty catheter. The inflated Fogarty balloon will essentially coax out the blood clot while you pull it. So you have to advance the Fogarty catheter deflated past the point of the blood clot, as you see here in part A of the image. And then you will help the surgeon to inflate this balloon. And then the surgeon will then pull the catheter back out. Because the balloon is inflated, it will pull the blood clot with it. So Fogarty catheter. Number 7, which is the most commonly used autograft in peripheral vascular surgery. Without question, this is the greater saphenous vein. That is the most common one by a long shot. Number 8, which imaging technique will be used to evaluate blood flow following vascular anastomosis? Surgeon's going to use a Doppler. Usually this is going to amplify the sounds of the blood rushing through the vessels. This is to make sure that the anastomosis isn't too tight and the blood flow is flowing as it should. Number 9, which instrument may be used to occlude major blood vessels? You are going to use a Satinsky clamp. This is an atraumatic angled clamp commonly used for occluding the vena cava or other large blood vessels. Number 10, which suture characteristics are preferred, when performing vascular anastomosis? You're looking for proline always, but do you know the characteristics of proline? It is a non-absorbable monofilament suture. Sorry, couldn't pause there. Number 11, which graft material will be used to repair AAA? You're going to use a Dacron graft. That is the most common one used. Can be cylindrical or tubular. Can also be bifurcated. It can be in that Y shape, but most often it's going to be Dacron. Number 12, extracorporeal hemodialysis is performed to treat end-stage kidney disease. This patient is in renal failure, typically around, it depends on who you ask, but about anywhere between 10 to 5% function, they're going to be on hemodialysis. And just pausing really quick to get you guys the access code for our Module 7 PASS certification review session. Access code is going to be 234088. Again, the access code is 234088. Keep going. The antagonist of heparin. That is protamine sulfate. Number 14, the removal of atherosclerotic plaque from the lumen of an artery. That is an endarterectomy. 15, which blade will be used to perform an arteriotomy? In order to perform an arteriotomy, it's typically a stab incision, and to do that, we're going to use an 11 blade. Usually pot smith scissors afterwards to extend the arteriotomy. Those are typically the 1-2 combo to create an incision and extend the incision in a blood vessel. Okay, switching a little bit into medical terminology review. On my go, you will pause the video and answer questions number 1 through 15 using your test taking strategies. When I say pause, you pause, answer, and then press play, and you'll come back. We'll go through the answers together as a group. On the count of 3, 1, 2, 3, pause. Welcome back. All right, which term means eyelids? That is palpebral, because bulbar refers to the eyeball or the globe. Conjunctival means the conjunctiva or conjunctiva, I don't care how you say it, but that's the mucous membrane that covers the eyeball and the eyelids. And then lacrimal refers to the lacrimal glands and the lacrimal system. That has to do with tears. So palpebral is your answer. Number 2, dacryocystitis is a pathology referring to inflammation of the lacrimal sac, because dacryo in medical terminology means tear, and cysto means a fluid-filled sac, and which fluid-filled sac is filled with tears? Your lacrimal sacs. Okay, number 3, which of the following surgical procedures is also known as the Whipple? This is C, pancreaticoduodenectomy, because you're removing the head of the pancreas and a really good chunk of the duodenum, if not all of it, and some other structures, but those are the 2 main ones. That's why it's often referred to as a Whipple, because pancreaticoduodenectomy is a mouthful. Number 4, posterior colporrhaphy is performed to tighten the walls separating, or posterior here, the rectum and the vaginal canal, because colpo means the vaginal canal, raphy means using sutures to tighten, and we are posterior, so we're looking for the structure that is posterior to the vaginal canal, which is the rectum. If the question asked about an anterior colporrhaphy, we'd have a different answer here, because that would be between the urinary bladder and the vaginal wall. So it depends, but you need to know which is which, anterior and posterior colporrhaphy. Okay, number 5, patient with menorrhagia is described to experience abnormally heavy menstrual bleeding. Menor is referring to menstrual blood, and then rhagia is excessive flow. Number 6, patient diagnosed with thrombophlebitis has a blood clot lodged in a vein, causing inflammation. Thrombo means blood clot. Phlebo means vein. Itis means inflammation. I don't know why I didn't go to the answer before I started explaining it to you. Sorry about that. Okay, number 7, pediatric patient with pectus excavatum is presenting with funnel chest. Pectus meaning the chest wall, especially the anterior chest wall. Excavatum means it, almost like an excavator, if you can think of the big truck that scoops out dirt. Excavatum means that it is hollowed out. So that's why it's called funnel chest. Number 8, which of the following prefixes refers to something being false or untrue? That's going to be pseudo. Anti means against. Mal means bad. Neo means new. Number 9, if a patient is diagnosed with hypokalemia, always have to think about this, experiencing lower than normal blank. So kalemia, K, I always think of K plus in the periodic table of elements. That's sodium. Oh, excuse me. God bless America. Sodium is Na plus. Excuse me. Potassium is K plus in the periodic table of elements. That is really embarrassing, Brie. Sorry. Excuse me. So If a patient was diagnosed with hypocalcemia, we would be looking for lower than normal calcium levels. Hyponatremia would be low levels of sodium. And then anemia would be iron. Okay. Sorry about that, guys. Woof. All right. Cholelithiasis refers to the formation of gallstones. Chole means bile. Litho means stones. And then iasis means the formation of. So this is going to be gallstones. When performing a hypophysectomy, the surgeon will remove the pituitary gland because the medical term for the pituitary gland is the hypophysis, and ectomy means removal. Number 12, the brachiocephalic artery supplies oxygenated blood to which body parts? Brachio means upper arm. Cephalic means referring to the head. So this is going to be head and right arm. Behind the knees, it would be popliteal. Liver and gallbladder would be, well, the liver, the artery that supplies the liver is the hepatic artery. The one that supplies the gallbladder is the cystic artery. And then the artery that supplies the small intestines is the mesenteric artery. Number 13, if a burn patient requires a skin graft derived from porcine dermis, this would be considered a xenograft. Allograft means another human. Autograft means from the patient themselves. Homograft, same species. So this would be another human as well. And then number 14, adenocarcinoma is a type of cancer that originates in the glands. Adeno means glands, and that can be within the glands of any organ. And number 15, a chondroplasty is a surgical procedure performed to remodel damaged articular cartilage within a joint. Chondro means cartilage. Plasty means reconstruction. Remodeling is under that umbrella. Okay, that's it for me today. I really appreciate you guys being here. If you have any questions, comments, concerns, you know where to find me. I will see you next time. Thank you. Stop recording.